Assalamualaikum dan selamat pagi. Today we meet again over a cup of coffee, right? And secawan kopi by Safety First Group. Yeah. And today we are very lucky to meet Dr. Hugh, who is the Medical Director of KPJ Klang. Let's see what he's got to say today. Okay, over.
Very good morning, all Safety First members, and especially to Dr. Samad, the founder of Safety First. I'm Dr. Hugh from KPJ Klang, and today we'll go to something simple and very common like gallstones disease. The incidence of gallstone disease is about 40 to 50% in Malaysia, making it one of the very common disease. And most of the time the patients are very quiet. They don't actually have any symptoms and can often be confused with gastric issues because the neighbor of the gallbladder is actually the stomach. Now let's have a look at the diagram which I'm going to show you. Alright, so if you look at this diagram, this is the liver, this is the stomach with the small intestine, this is the gallbladder, this is the common hepatic duct, this is the cystic duct that brings the bile from the gallbladder down, and this is the common bile duct joining with the duodenum around here. After we eat, the food will actually come down into the small intestine and the bile will come down to digest the food which we eat. Formation of stones can actually move around and sometimes move to the neck of the gallbladder and cause obstruction, causing inflammation of the gallbladder and pain. And often bacteria can also migrate up into a gallbladder, causing infection of the gallbladder, which gives the disease acute cholecystitis from inflammation of the gallbladder. Okay, so when that occurs, when the gallbladder is impacted, the stone impacted the neck of the gallbladder, it gives a patient quite bad pain. The pain score is often about 8 or 9, and the patient often can have fever and they can't eat because the gallbladder is not functioning, and they often come to the hospital, to the emergency department. Most of the time, we will actually have to confirm the diagnosis with an ultrasound of the gallbladder and a CT scan of the abdomen and pelvis. Following that, we will have to perform a surgery to remove the gallbladder. I would like to show you some of the complications or some of the effect of this acute cholecystitis. I have a few sample photos which I want to show you. In this picture, we can see that the gallbladder is badly inflamed with areas of inflammation. You can see pus formation around the end of the gallbladder, the Hartmann's pouch of the gallbladder, and the body of the gallbladder. Next. In this second case, we can see the gallbladder is actually badly inflamed with dusky and red areas. And when we open the gallbladder, you can see that inside the gallbladder, there are a lot of pus coming out from the gallbladder. So this is a infection of the gallbladder causing empyema gallbladder. This is the third case which I'm going to show you. In this case, the gallbladder is actually badly inflamed, the whole gallbladder with areas of gangrene. You see these areas are turning green, these areas are actually dying, and there are the pus around here. And when we open the gallbladder, it's actually full of gigantic gallstones inside. Hi. So the complication of the gallstones disease can be very serious, especially if the patient have diabetes mellitus and the patient is in the elderly age group. But like I said again, most of the patient actually just have very minor issues, a bit of gas distension, very similar to gastritis. So for patients who have this kind of symptoms, perhaps they may want to seek professional help to determine whether it is actually gastric problem or gallstone problem. And obviously when it is severe pain with fever, with unwell, cannot eat, poor appetite, vomiting, these are the very bad indication that you need to come in for an urgent surgery. Hi again. So basically after removing the gallbladder, my patient, the main concern is, alamak, remove the gallbladder, doctor, what is the side effect? I will always tell them there is no side effect. Let me explain to you a little bit about the normal function of the liver to explain to you after removing the gallbladder what is the side effect. Let's refer to the slide. Okay, the function of the liver is to break down the remnant of the hemoglobin into the porphyrin ring, which will then be changed into bile. So the production part is actually the liver. The gallbladder is the storage part. After the liver produces the bile, it moves downwards. This is the right hepatic duct. This is the left hepatic duct, which will go into the common bile duct. And once it reaches the mid part, there is a spiral valve inside this cystic duct, which will move the bile into the gallbladder for storage. After we eat, our stomach is full, it will signal to the gallbladder to pump the bile down into the small bowel for digestion. Now, as you can see, the production area at the liver is intact after removing the gallbladder. And you can see now the bile moves directly into the small bowel for digestion. So in actual fact, there is no side effect after removing the gallbladder. So as you can see, after the surgery, there is actually no effect on digestion. Of course, in the initial part of any surgery, whether it is a minor surgery like appendix or a major surgery like laparoscopic cholecystectomy, you may not want to eat very oily food because after the anesthesia, you might not feel that well. But in the long run, there is no side effect from removing this gallbladder for in terms of effect of health to any patients. So, the surgery for removing the gallbladder is often referred to as laparoscopic cholecystectomy. Basically, the patient is put under general anesthesia and the surgeon will insert a camera port into the umbilicus, into the peritoneal cavity, and then we look at the anatomy of the liver, the bile duct, and the gallbladder. From there, we look for the cystic artery and we either clip it or use the diatomy to burn it, and we will clip the cystic duct before removing the entire gallbladder together with all the stones. And all this procedure takes about 45 minutes to 1 hour in a straightforward case, and it can go up to 2 hours in a very difficult, complicated case. The recovery is very simple, very simple. Most of the time, following the anesthesia, once the patient recovers from anesthesia, the patient can start to drink a bit of water. And if there is no side effects such as vomiting, the patient can eat. And by the next day, the patient will be up and walking around, following a simple wound inspection just to make sure the wound is healthy, there is no bleeding, no infection. The patient is sent back home. The recovery is again very straightforward here. Perhaps a week of rest at home, and the next week, the patient will be back for a follow-up, and we will review the report of the histopathological specimen which we have sent to the lab to make sure there is no other things like cancer, and probably that's the end of the treatment already. So to sum it up, gallbladder disease or gallstones disease is actually very common. It's about 40% in Malaysia. Not every patient needs surgery, but those who have complications before, who have already having recurrent pain, may want to consider surgery. The only way you can tell whether you need surgery or not is to seek early help from the medical profession, and perhaps they will advise you accordingly. Lastly, I would like to thank Dato Samad for giving me the opportunity to educate ourselves a bit on this gallstones disease. Thank you very much.